Hello, this is Jeremy Crane of the Leprosy Lads group from Dr. Pochron's S340 class. This group also contains Jacob Murphy and Shuiab Folarin. And this is our Leprosy Lads lightning bolt quick review of the New England Journal of Medicine article, Dying in a Leadership Vacuum. So to start, let's get back to what public health means. If you just consult Google, you get the definition as the health of a population as a whole, especially as the subject of government regulation and support. According to the CDC, public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. So, how has the federal government stacked up to these definitions during the pandemic? Our organized efforts and informed decisions will come to mind when we reflect on how the administration has handled the coronavirus outbreak. To the editors of the New England Journal of Medicine and to many other people, that answer is a resounding no. So, the editorial in question, Dying in a Leadership Vacuum from the New England Journal of Medicine, is both fascinating and infuriating. It's a kind of review of how the Trump administration has responded to the coronavirus pandemic. The scathing critique offered by the editors of the New England Journal of Medicine serves as both professional advice from medical experts and a warning for the American public that the federal government has failed its country and should not be rewarded with re-election in this upcoming election year. So, what is the federal government doing about the pandemic? According to the editorial, they have mostly delegated responsibility to the states, which has created a patchwork of rules and regulations. Some states have responded to outbreaks with clear and diligent policy and scientific evidence backing their decisions, while other states have let politics instead of science and public health guide the decisions and often leading to severe outbreaks and avoidable consequences. The persistent divisiveness and antagonism of the presidency has not made anything much easier. We distinctly remember, for one example, how early on in the pandemic, the president hesitated to give aid to New York and other states that were experiencing early stages of the coronavirus outbreak because these governors were or continue to be critical of him. Not the best way to save your own citizens. Related to the last slide, what is the federal government not doing? Well, according to the editors, they aren't relying on their own scientific and medical experts, ones that are literally some of the best in the world. They're not implementing unified and clear policies, which would enable a more effective approach to a crisis that has now engulfed the entire country. Guidance has been inconsistent, vague, and always has carried the suspicion of tampering for the political gain of the president. If we can't trust our own federal agencies, then can anything we do be truly effective? Long respected institutions like the CDC and the National Institutes of Health have either been muzzled, disregarded, or used for political purposes. The fixes to these problems are clear. One, the current administration needs to trust its evidence backed experts and listen to the science of the matter. Considering the president's prior actions and beliefs, however, hope for that seems thin. A nationwide policy such as a mask mandate would also provide long overdue clarity and leadership during the coronavirus crisis. The article ends with the editors imploring the American public to vote out the Trump administration, an incredible move by the journal. So, why is that so incredible? As it turns out, in 208 years of publishing, the New England Journal of Medicine has never commented on any American election, much less a presidential one. Furthermore, only 4 other editorials in the journal's history have been signed by all of its editors, as Dying in a Leadership Vacuum has. This is a truly unprecedented act. However, these are unprecedented times, where the federal government seems incredibly reluctant to help its own people during a public health crisis. We would be remiss to not touch upon the social justice issues that are happening within the pandemic. CDC data has found staggering differences in how different ethnic groups in America have experienced the pandemic. People of color, particularly Black, Hispanic, and Native American people, get infected at over double the rate of their white citizen counterparts. They're hospitalized at a rate of around 5 times higher as well. Black patients also die at twice the rate of white patients. There are a multitude of reasons why this is the case. Systemic discrimination in our healthcare and housing systems, harder access to healthcare for these groups to begin with, and having more people in these groups working essential jobs that have increased their risk of exposure to the disease are only some of the reasons the CDC gives for these disparities. The coronavirus pandemic is laying bare inequalities that have already existed in our society, ones that are now proving fatal. So, we would like to leave you with one very important thought to conclude this presentation. As of October 16th, 218,000 Americans have died from COVID 19, and the number is quickly growing. The federal government has demonstrated extreme incompetency when it comes to their handling of the pandemic. But we do not have to accept their failure. In only a few short weeks, the American public gets to decide who will inhabit the seats of government for the next few years. For the country's sake, the editors of the New England Journal of Medicine hope that we do not give the Trump presidency power again. And quite frankly, us Leprosy Lads believe the same. So this is our reference slide. It includes the original editorial in question, Dying in a Leadership Vacuum, which was published on October 8th, and other sources we used, including information from the CDC website and a Washington Post article about the editorial in question to further help us create this presentation. And here is credit for everybody who worked on the presentation. Thank you very much for listening. Stay safe.